I see a lot of young athletes that have worn out their joints at an early time period. And we're trying to recreate that natural feel. And I think you can do that better with a more precise fit. Everybody has their own specific micro variations in their shape of their joints, and that comes into play with how that knee flexes and extends and rotates. With a Conformis knee, I know that I'm going to establish the normal mechanical axis based on the algorithms that the computer has generated. The cuts that you make are going to be spot on, and the instrumentation that we use is so precise to put that implant in, and it's specific to each patient. To me, if you can make an implant that recreates that patient's specific anatomy, that knee is going to be more comfortable to that patient. They're used to a certain kinematic pattern of how they've used their joint their whole life. And we're trying to recreate that natural feel. And I think you can do that better with a more precise fit. You're recreating the normal J curves in the knee. You're recreating the normal offsets in the knee. The implant's going to go in the perfect position, and it's going to have less stress on the ligaments and the soft tissues. The Conformis knee system does tend to have a much more quick return of range of motion, and most of my patients get into a fairly deep knee flexed position more easily than the off-the-shelf knees. My patients with the Conformis feel very confident. When they come back at 6 months, a lot of them are back doing rather significant activities at a high level of function. It's a system that allows my patients to rehab a little faster, to feel a little bit better functionality with their knees, and to get back to the sports that they love. So if they're happy, that's what we're after. We're after trying to create the best functional outcome for patients that's going to last over a long period of time. The first implant that I put in, I was amazed at how remarkably simplistic the system was. A lot of the design of the implant and the manufacturing process of the implant makes it more simple to use. The motion that I see in a Conformis knee during surgery is a full range of motion and very stable, both in flexion and extension. Given all the considerations in doing a total knee replacement and the technology that's available out there, if I had to have my own total knee replaced, I would use the Conformis knee.